Hello, this is John Kanellopoulos from our office here in Athens. I'd like to share with you an extremely pivotal point in following keratoconus patients, especially after cornea cross-linking. This happens to be a young gentleman that had the Athens protocol, partial refraction, topography-guided eczema ablation, and higher fluency CXL in 2017. And we're following here January of this year and today. May of this year. So we're seeing a 4-month difference, and the cornea has steepened some. You can see steepest part of the cornea here with the Scheimpflug tomography, 46.2, now 47.3. It's a significant difference. One would endeavor that this is progression of keratoconus, but we have advocated this for many years. We've published many reports. Let's go and look at this in a different way. This is the January image of that same patient showing that the cornea had very significant keratoconus. These are pachymetry images with the 9mm Optovue anterior segment OCT. And let's spend a little bit of time on the epithelial maps. Look at the old area of the cone. This is 2 months after the cross-linking procedure, and that area is still very thin, rebound thickening around it for the body trying to hide the area of the cone. And this is now 4 months later, and you can see the dramatic difference between these 2 points, how it was and how it is now. So in my opinion, the sine qua non that here, the steepening on the pentacam maps is just a product of epithelial remodeling, and actually the epithelial remodeling assures us that there's no progression of keratoconus, since the epithelium is thickening over the thinner area of the cone and not the opposite. If these images were reversed, meaning the before was like this and the cornea now is like this, this would have been the pivotal point to establish that the superficial steepening on the pentacam maps are actual progression. So I beg to differ. This, in my mind, shows me that the patient is super stable. The epithelial remodeling is changing the, let's look at the pentacam maps again, is changing the cornea steepening from here to here. Nothing to worry about. We'll follow this patient up in 6 months. Of course, reinforce to abstain from eye rubbing. Thank you so much for following this.